just so it gets done. There we go. And so we will be offering the video of this probably tomorrow so that you can re-watch it, or for anyone that misses tonight, they can see it. In order for us to determine what to offer next year in terms of educational content, please fill out the evaluation. And I believe that Nicole has already given that link to you as well. So please fill out that SurveyMonkey and let us know what you want to hear for next year. We couldn't do any of these webinars without our facilitators. And for years now, probably about 21 of these years, we've been very thankful that we've had facilitators to do these winter courses. And Chris Buschbeck has done a number of them for us and spoke at Grey Bruce Farmers Week and other things. So we are very appreciative that she's done that for us. And I wanted to read a bit of her bio. I went on to the Markdale Veterinary Services website, and this is what it says there. Chris Buschbeck was born in Germany a long time ago, which made me laugh, where she attended the university in Kiel and earned a master's degree in agriculture. After immigrating to Canada in 1988, she worked for the University of Guelph as a research assistant before going back to school for her degree in veterinary medicine. She has been working at Markdale Veterinary Services since the year 2000, when she, her husband, and two boys relocated their dairy sheep farm to Grey County. Chris is involved in the sheep industry as a breeder of East Friesians, a frequent lecturer at producer meetings, and an owner of SR Genetics, a company that offers artificial insemination services for sheep and goats. She is currently the past president of SRVO, the Association of Small Ruminant Veterinarians of Ontario. Chris and her brother used to be avid 3-day eventers, but now settled to take their horses for a good run through the bush when they find time. So that's an introduction to Chris. We also want to get to know you guys as well. So we want to do a couple polls. So I'm going to put the first one up on the screen. So the question is, how many sheep do you have? So you can fill out your correct response, and then we will show you the results. Just gonna wait a second to make sure I've got everybody. Looks like we probably do. So it looks like the majority are in that 21 to 100 classification. So that's cool. And then I'm going to launch another poll. Oops. So how would you rate your knowledge of lambing issues? Would you say you're a novice, you're a bit unsure, feel fairly competent, or you can handle almost everything? Okay, so I'm going to end the polling. I'm going to share results. So about 54% are in the category of feeling fairly competent. So that's great. So by the time that Chris ends tonight, you guys will be definitely pros. So Chris, shall I start sharing your presentation, or do you want to talk first?
Nope, that's fine. Just let it roll. I don't know whether you can keep, I don't know what you do with a picture. You might just see a black square for the speaker. That's fine.
Okay, so you should be able to see your first slide.
Okay, that's a title. So keep trucking. Go to the next one. Okay, so what we're going to talk about is just an overview. I mean, this is a huge topic, and you could spend weeks talking about it. So I've been trying to just highlight a few things, and then you can, you know, with questions, we can maybe go a bit more into things that you're more interested in or feel you need to know more. But I'm going to just sort of give an overview of things that I think are important to think about, and then we can discuss further as we go through. So basically, the steps as I see them is, you know, we're going to talk a little bit about planning, the pre-lambing period, lambing itself, the neonatal time, and then how to investigate problems or how to go about it. Next. So the planning ahead involves to decide when do you want to lamb, how many lambing ewes can you handle? You know, how many per day make your day go well or terrible? How many can you accommodate per lambing period, you know, before you run out of barn space, or before, you know, you run out of, lose your mind or something like that? And what are the bottlenecks? Because, you know, it's easy to say, oh, I'm going to synchronize these sheep and I'm going to breed, you know, 100, but then you have 100 of them lambing all at the same time at the other end. So you have to sort of decide a little bit. And the guy there says, like, it's the way to go, Frank. My life changed ever since I discovered stackable livestock. So barn space is often your limiting factor, either that or just workforce, right? Like, how much can you handle if you're by yourself, or how many people do you have helping you? Okay, next. So really a good lambing starts at breeding. That's where you make the decisions that come out on the other end. So are the ewes in good condition? Do you have the right rams? Are they fertile? Do you have the correct ram to ewe ratio, meaning that, you know, the boys can do the job, that they all get bred on the first attempt and not come back because you didn't get around to everyone? Are you keeping this season tight, meaning that, you know, your ewes are lambing in a tight window, or are they going to be spread out over a long time? And I'm not saying that you have to do that, because, you know, maybe that works for you, that there's a ewe lambing, you know, here and one there, but most people find it easier to handle if you know that the next 3 weeks are going to be crazy, but then you're done and you have a more uniform lamb crop, right? And also body condition scoring and checking over the ewes at breeding time, you know, will help weed out things that might cause you problems down the road. I have that problem every year where I go, oh, I'm going to give that old girl one more go, and then come lambing time, you know, she's the one that goes down with pregnancy toxemia, or has other problems, or has no milk or whatever, and go like, well, probably should have, you know, shipped her and not gave her one more chance to lamb. Next. So gestation really falls into 3 trimesters, 3 sections. So the first one is right after breeding, implantation and placentation. This is like 30 days at our determining your lambing success, because that is where you lose most of your lambs. So ewes that don't hold on to a pregnancy because they're not, the embryos don't implant properly. That can be because of stress or because of other issues, and placentation. So the lamb determines at that point how much placenta he's going to have or she's going to have, and that determines how big a lamb you're going to get. So if you have, for example, 3 lambs or 3 embryos being fertilized, and they implant but not right good, but they take up a space in the uterus, and so they will each take up a third of the uterus, and 2 of them are lost because of nutritional issues or other issues. The one that is remaining will be a very small lamb, because you only got that 1/3 of the uterus that he claimed space to when the placentation occurred. So it is important that, you know, we feed them well and keep them stress-free in the first 30 days after breeding. The second trimester is really just where things develop, you know, the fetus forms, you know, all the organs and so forth. And then in the last trimester, there's really only growth happening. Everything has been formed and put in place, and now the fetus takes the nutrition to grow to its final size. Next. So we're now going to talk just a bit about pre-lambing preparations, and those are thinking about nutrition, about vaccinations, about what supplies we want to have, and a little bit about barn setup. Not going to go into super detail, but if you have questions about it, then kind of ask, right? So as I just said, the fetus grows most in the last trimester. And so that means that demand goes up, but at the same time, it takes up the lambs take up more and more room. So, and that goes at the expense of the rumen. So as the lambs take up more room, the rumen has less room. And that means that the sheep need more easily digestible feed at the end of the gestation, and some feed that goes in and out quickly so that it doesn't sit there forever and take up space. Because otherwise, you can't extract enough nutrients from your food if it just, is some scrunky hay that sits in the rumen forever in order to be digested. And the rumen goes from, having, being like half the size of the sheep to the size of a, head of cabbage if you have lots of lambs in there. And so there's just not as much room in the stomach. And so you need to have something that goes in and out quickly. So good quality hay or haylage, and in a lot of breeds, some grain that will replace forage. And then the other thing to think about is like, what is this body condition score of the ewe, right? Because the fetus takes a percentage of the energy. So meaning that if, for its growth, the ewe gets a certain amount and the fetus takes a percentage of it. With protein, the fetus actually takes what it needs. So if that fetus needs 26 grams of protein a day, and you're only feeding the sheep 12 grams, the fetus still takes 25 grams. And the rest of it, the ewe will have to take off her own back. So meaning like she actually mobilizes amino acids out of her body, which come out of her muscle mass. So if you're not feeding them enough protein, then, they can literally waste away. And we have seen that in not so much in sheep, but we have seen it in cows in years when the hay is really poor, and those cows eat just poor quality hay at the end of gestation. All of a sudden they go down and can't get up because they literally have eaten their own muscle mass to feed the fetus. So nutritional deficits are very hard to correct when they come close to lambing because of the smaller rumen capacity and the demands of the lambs. So it's important to make sure that the body condition is good. 5 to 6 weeks before lambing, you really have to get cracking if you want to correct anything. Next. So problems you can run into is hypocalcemia. This happens mostly before lambing. It shows up as weak ewes that can go down, that sometimes sit in unusual positions, like with the hind legs out straight behind them. And it's mostly because you have a large load of lambs inside the ewe, and the skeletons are mineralizing at this point, which means that the calcium from the ewe goes into the bones of the lambs, and it also goes into milk when they're making udder. So if we're running low, we give the ewes calcium borogluconate. Mostly I give it under the skin. And then also it's important to have the right phosphorus calcium mix in your ration, and a good mineral and vitamin balance to prevent this. Next. And it often happens together with what we call pregnancy toxemia. And it's hard to distinguish the two items because the pregnancy toxemia is basically a lack of energy. That means that they can't keep the glucose level up in the blood, and they're basically like a hypoglycemic, and they get staggery. They smell like acetone. Not everyone can smell it. It's a genetic thing whether you can smell it or not, but if you can, it sort of smells a bit like nail polish remover, or slightly sweet. They show neurological signs. They stagger around, they go down, they're off feed. Basically, when they're low in glucose, they mobilize fat. to break it down and then produce glucose out of it. And it's a process that leaves like some byproducts, and those make the ewe kind of nauseous, right? And so then they feel even less like eating. So it's important to get their blood glucose up and to give them energy. And ideally, you do that before they go down. Usually, we drench them with ketamol glycol. We sometimes give them dextrose intravenously, but basically, it's prevention is always better than treatment. So increasing the energy density of the ration. This can happen in sheep that are too fat or too skinny, because if they're too skinny, they literally run out of energy. And when they're fat, you know, and they have a big load, and their rumen gets smaller, and then they start breaking down the fat. And these are often harder to treat than the skinny ones that are where it's a straight just lack of energy. So sometimes the fat ewes that go down, they have fatty liver at the same time, and so they can be a bit of a trick to treat. Basically, the goal should be to prevent this from happening. Sometimes what we do is we induce them to lamb and try to get the lambs out of there so that the ewe can recover. But it's a possibility then that you lose the lambs. Okay, vaccinations. So sheep have a placenta that does not pass antibodies through to the lamb, and so what we try to do is we try to increase the antibodies in the colostrum in the first milk, so that the lambs are protected that way. Generally, we vaccinate them about 4 to 6 weeks before lambing, and most sheep would just be vaccinated with a clostridial vaccine. So that's Covaxin or Tasvax, or there's a pile of different brands, but basically this is against all the clostridial diseases like tetanus and overeating and blackleg and enterotoxemia and pulpy kidney and whatever they're called. They're all in the same family. Their hallmark is that they're easily prevented by vaccination, that they're mostly fatal if they happen, and they're not treatable. So in general, we recommend that you give a clostridial vaccine to everyone yearly before lambing. Other vaccines can be given as indicated. There's a vaccine against caseous lymphadenitis, and it has clostridial vaccines in it as well. So often that is used before lambing instead of just the Covaxin. If you're vaccinating against abortion diseases, that needs to be done before breeding and not before lambing, because at that point it's too late. And then there is also a Staph aureus mastitis vaccine that's pretty new that is definitely of interest for dairy sheep and dairy goats. Next. Lambing kit. So that's basically just a picture of the tote that we're using. It's like just to keep your mind on like what you need if you're assisting with lambing. So basically you need lube, you need some more lube and some more lube, lots of lube, gloves, and then maybe a head snare to help to deliver lambs. Then something to process the lamb, so ear tags, rings, applicators, vitamin E, selenium, iodine spray for the navel. I like to have a thermometer on hand to see that, so you easily identify hypothermic lambs. And then feeding tube supplies, lamb bottle and a nipple. Record keeping, whether you have a record keeping book or you have electronic records, it's important to keep records, and then just a box to pack it all together in. So what you see there is what we lug to the barn to process lambs or help with the lambing. And that's just a picture of most of these things spread out. So the iodine spray, it's a question of whether you want to spray the navel or dip the navel. it is really, as long as you get the navel covered, the end of it covered, and all around, it doesn't matter. I sit the lamb on its butt and spray the length of the navel as it lies sort of along the belly wall. You can dip it, but you don't, if you're dipping in a container, often the stuff gets dirty, so you would have to discard it and use fresh iodine to dip the navels. Then a loop, bottle, and gloves, thermometer. What you see up in the top corner there is a Brix meter. That's a little refractometer that you can check how good your colostrum is. This is not something that most people would do. It's just with the dairy sheep, we feel that sometimes they have so much milk that the colostrum isn't very good, and it gives us an idea of how good the colostrum is. You can pick these up for 20-30 bucks. They're pretty good. Like, you look through and it gives you a number that tells you the Brix value of your colostrum. Just put a drop on it looks like a little slide. And then just below that is a feeding tube and a syringe. And so that's to tube lambs that don't, if you want to tube them as colostrum or something. And yeah. Next. Just a little bit about barn setup. It's pretty much an individual choice. A lot of things work, and in the end, I find that most times, if you're at it long enough, the sheep that survive like your system, and so you all get along well. There's a couple of points that are worth considering. One is, obviously, how much space do you need, and then the flow of the sheep. Like in our place, we sort of lamb on one side of the barn, they go into the lambing pens, and then from there they go over to the other side of the alley, which kind of keeps the lamb group away from the still to lamb group, so that when you check them, you can you don't have to check through the masses of lambs to see if someone's new. You just see it because they're in a separate spot. Thinking of the comfort of the lambs, like wherever you put your creep feeder, that it's draft free, that there's the sheep can see the lambs, and but they can get away from everything and have a nice place to sit. Something that supports the bonding and the lung growth. So like do you use individual lambing pens, and where do you put them? And it also helps in the prevention of disease. So if you're thinking of, if you have ewes aborting, do you have a spot where you can isolate them away from everyone? Or if you have, I find that if you have lambs that are, scouring or something, having new lambs born not in that space is helpful, so they don't pick it up right away. All these things are kind of like a thought. And then how easy is it to spread straw or other bedding? As a general rule, I find you can never have too many gates, and you can never use too much bedding, because both of those things help you with your management quite a bit. So having an extra set of gates to pen this one ewe up somewhere, and just keeping the straw down so that they stay warm and dry. So normal lambing happens in 3 stages. The first stage is often not even observed. It's just the ewes get a bit uneasy. They separate from the group. They might not come up to eat when you put down feed. They might be pawing in a spot and going up and down and sort of making a nest. During that stage, basically there's some uterine contractions, and the water bag is pushed against the cervix from the inside and slowly dilates the cervix out. And that stage can take 1 to 8 hours. And it depends. Usually ewe lambs take longer for everything in this scenario, and some older ewes can go through the stages fairly rapidly. In the second stage, which is like the actual lambing, this is where the water bag ruptures, the fetus enters the birth canal and is expelled. And this is active labor, which means there's uterine contractions, but also abdominal contractions. The sheep will lie down and more often they will lie down and push, and you will see that basically this lasts somewhere 15 to 30 minutes per lamb, with another 15 or 30 minutes between lambs. With every contraction, you should see a little bit more of the lamb appearing when you're watching this, so that there is actual progress being made. So, you know, when she pushes, it comes out, maybe the nose appears, and then she takes a breath and relaxes a bit, the nose disappears, but with the next contraction, you know, a little bit more of the nose or half the forehead appears. So every time there's a contraction, a little bit more should be visible until then, you know, the lamb comes out. And then the third stage of normal lambing is just the after birth being passed, and that usually happens fairly quickly, but can take a day or so. And it's generally not considered to be a big deal if they don't pass it right away. Like if they haven't passed it in 12 hours, I'll keep an eye on them, but not worry too much. All right, we're going to talk about some lambing problems. So problems around lambing. One is prolapses. So there's two kinds, usually the vagina prolapses or the uterus prolapses. Malpresentations, meaning that, you know, lamb doesn't come in the correct way. Fetal maternal disproportion, that's just a way to say the lamb is too big. And then a couple of others, there's ringworm, twisted uterus, and prepubic tendon ruptures that are more in the weird category. So of the prolapses, the vaginal ones are more common and more annoying, and generally means that we recommend that you cull this ewe after, you know, well, try to get her through lambing, but then cull her, because in general, we find that ewes that prolapse their vagina before lambing tend to do it again the next year and worse. And it's it can be a real pain in the butt, literally. So as I said, it happens before lambing. It's usually because there's a lot of softening going on and stretching, and sometimes it is because there's a lot of load of lamb in that ewe, and something has to give, and so she pushes out. Usually it's the floor of the vagina that is sort of prolapsed out. This needs to be replaced to allow for normal lambing, because at the top one there on the, I don't know, you can probably not see my pointer. The top left one there, you can see that little, like almost like a buttonhole there in the, that's actually the cervix. So this sheep has pushed the cervix right out. And so you can imagine that when lambing starts, that the water bag will not be able to stretch this out because it's not in the right place, right? So this needs to be replaced, and usually we put a harness on or put a suture in, depending on how bad it is, to keep this inside until she's ready to lamb. The reasons for this are partially genetic. It can be because of really short tail docking, because some of the muscles get disrupted that are going from the tail web forward, and so then there's not enough support for the back end, and it happens easier. It can happen when you're feeding bale feeders, and over time it builds up, and so the sheep eat at an angle, like they're sort of standing uphill. And when you think of like a lot of lamb in there, and the pressure goes onto that pelvic floor, and something gives. The same can happen if you don't have enough feeder space, and you put the grain down, and there's like a 2-inch space, and then 20-inch white sheep decides that she will fit into that space and just barges in, and her abdominal content is literally pushed backwards. So all these things can contribute to vaginal prolapses. And then uterine prolapses happen post-lambing, after the lamb is out. The ewe keeps pushing and the whole shebang comes out. This is an emergency because this stuff shouldn't be on the outside. But it's also just a shit that happens occurrence, meaning that, you know, if you get this replaced properly, she can go on to be just perfectly fine and doesn't necessarily need to be culled. If you want to replace that yourself, I find it helpful to basically lie the ewe on her back and then lift the hind legs up onto a bale so that her butthole's just straight up in the air, and then the second person can sort of slowly massage this back in after cleaning it up a bit. Most people prefer us to do that. Okay, next. All right, malpresentations. You probably all have seen some of these diagrams, which, you know, which says like a normal presentation is the nose and the feet coming, and then anything else is possible. Basically, if you have to help a sheep because, you know, you haven't, you know, she hasn't made any progress and you think something's wrong, the main thing is to figure out what's going on inside, right? So work clean and gentle and use lots of lube and use gloves. So you would like clean everything up a bit and then go in with lots of lube and feel around and see what you find. You know, you'll either find a head that is, or you don't find a head, but you find two legs. So, you know, you will have to figure out, you know, what the position is and the presentation and correct it so that it's in a normal position. So you would have to either have two front legs and a head coming in the right direction, or two hind legs and a tail. And I'm not saying that because it's important to put the tail in the right position to pull it out, but it can be easy to not be able to tell whether they're front legs or back legs. And if you pull the leg because if you start pulling because you think the lamb is backwards, but it's really like the middle presentation there where the head is turned back, it will not come out. So you will have to be pretty sure that it's forward or backwards before you pull, and that everything is coming in the right position to each other. Okay, next. So if you have very big lambs, basically it's a matter of plenty of lube and patience. You need to fit the head and the legs into the pelvis. What I usually try to do is try to get it so that the head is in the pelvis and the legs sitting underneath, and then you try to advance one leg at a time, so that you almost like walking the elbows out through the pelvic canal. If you cannot get the head into the pelvis together with the legs, you cannot deliver this lamb through the pelvic canal. So that is a lamb that might have to come out with a C-section. Because if I have had cases where you went in and you feel the legs, but you know, so both legs are in the canal and there's only like a 2-finger space left between the legs and the pelvic bone, and you know that there's no room for a head to get through that space. So there's really no other choice to get this lamb out. Most of the time, if you get it forward, you will get it out. Ring room is a problem where the cervix doesn't dilate, even though probably the water bag has pushed against it, but then ruptured prematurely, and so it's lacking that extra push to open it up. There's not a lot of knowledge about why this happens. There's some thought that it's a mineral has something to do with it, but basically it's a if the cervix is partially dilated, with a lot of patients, you can often manually dilate it, meaning that you sort of do like stroking movements on the rim of the cervix until it gets big enough to deliver a lamb. If it doesn't open at all, then either it's a matter that she's not quite ready and you wait, but if the water bag has burst and you can't get it open, then again it might be a case for a C-section. Twisted uterus doesn't happen very often. It's rare occasion, and it probably needs professional help because they can be hard to fix. And the PUYU that you see there is a prepubic tendon rupture. So that means that the tendon that holds the internal body wall up, it's attached to the front of the pelvis. And so it creates like a sling from the back of the ribs to the front of the pelvis. And in that sling sit all the internal organs and the lambs. And if that tendon ruptures, then basically it's only the skin that holds everything together. This is like almost like a giant hernia. And so the lambs, you can see that the udder has gone down onto the floor, and the lambs almost sit on the floor. So this again is they usually don't dilate, and they might need a C-section and then a trip to the somewhere depending on how they look. So this is just a little chart of like when do you intervene in a lambing. Stage 1 is more than 8 hours. So if she's mucking about for a day and nothing's happening, then that's time to check. If your water bag's out for over an hour and nothing else is happening, time to check out. If she's actively pushing for like 30 minutes and again you don't see anything happening, it might be that the lamb is sideways or something, so that nothing's coming out. Or if she initially makes some progress and you maybe see like tips of feet, but they stay like that and it doesn't move, and then she quits. Similarly, if you gets exhausted or looks fatigued or distressed, I mean, sometimes you can see that parts of the lamb that are showing are yellow. Certainly, anytime that happens, you want to check it out. Or if you have an observed abnormality, like saying a head is sticking out, but you don't see legs, and that needs to be fixed and you need to help. Those are the really easy ones, when to call for help. You don't know what the problem is, call for help. You know what the problem is, but you don't know how to fix it, also call for help. Or if you know the problem and the solution, but can't fix it in a reasonable time. So basic. All right, I don't know, are there any questions about this? Are there any positions that you really wanted me to go over how to fix them, or any specific questions?
I haven't seen any questions come through in the chat box, Chris. There was a question earlier. How do you treat a newborn lamb that is badly aspirated? Okay,
we're coming to lambs in a minute here. We
can
do that.
Sure. Other than that, okay. I don't see anything more.
Okay, well, we can always circle back to it later. Okay, we're going to talk about lambs and lamb survival now. So we're going to talk about colostrum, a bit about bonding and shelter. Those are the things that you need for lamb survival. Those are the 3 main things: that it gets a good feed of colostrum, that the mother likes the lamb and they bond, and that the lamb has enough shelter. And I'm not saying that it needs to be, the Taj Mahal or something, but they are very small and fragile, and so they do need a minimum amount of protection. So colostrum is a really important topic. So colostrum is the very first milk, and it contains immunoglobulins or antibodies, or IgG. That's all kind of interchangeably used. It also contains a lot of hormones and lots of nutrients. So it is quite different from regular milk, and it assures that that lamb gets the best start possible. The colostrum production in the ewe begins really like about 6 weeks before lambing. Not in full swing, but that's when everything gets geared up. And that's how we time our vaccination, so that the vaccination increases the antibody production, and those antibody levels, as they increase, and then they move to the udder to be available in the colostrum. The IgG, or the antibodies, do not cross the placenta of the sheep. Like when you think of other, like human placentas, for example, there's only one layer of tissue between the mother's bloodstream and the baby's bloodstream, right? It's very close approximated, and so everything goes through there. In sheep, there's 6 layers, and so they're very much insulated from the sheep, and so they don't pick up a lot of the bad things that might be cruising around in the sheep, but they also don't pick up any of the good things. So they're basically born without immunity. And so we need to make sure that they get the colostrum. And so for the colostrum, we talk about the 4 cues. And so the one is to be quick. So the first feeding is important because the lambs only absorb colostrum or absorb antibodies during the first 24 hours. Their gut is very porous when they're born. And so when they take in the colostrum, those large antibodies pass through the gut wall into the lamb's bloodstream and supply them with the antibodies. And we talk about 24 hours, but really you have to imagine it as a curve. So that the gut is quite open, and then it goes down to almost 0 at 24 hours. So really we need to feed them, or they need to have colostrum in the first 6 hours, ideally in the first couple of hours. And at the same time, the colostrum in the ewe changes to milk over the first 48 hours. So while it's full of antibodies and goodness in the beginning, by 48 hours, it has hardly any antibodies left in it. And interestingly enough, this is not just because the lamb drinks it and it disappears that way. It's also if you have a sheep and you don't milk her at all, it will still, she will reabsorb these antibodies after birth. So they will disappear even if, her first milking happens like 24 hours later. It will be less rich colostrum than it was right after birth. So the next cue would be the quantity, and this is like how much does that lamb have to eat? And it should eat 10% of its body weight in the first 6 hours. So it's around 50 mils for every kilogram of weight. And you can give them up to 5% of their body weight in the first feeding, which, if you have to tube a lamb because, it doesn't suck or it was hypothermic and didn't get colostrum or whatever, if you're tube feeding a lamb, a 4-kilo lamb can get up to 200 mils at that feeding. And then it should get another 8 to 10% in the next 18 hours. Squeaky clean, that's basically obviously if the lamb gets up and sucks the udder, that's good. It just basically gets the clean milk directly into its mouth, so that's no problem. But if you have to milk the ewe and you have to use like a tube or a bottle or a nipple or anything like that, dirt interferes with the absorption of the colostrum by the lamb. It can bind to the antibodies, or the antibodies basically attack the dirt the bacteria in your dirty milk, and then they're gone. They're not available for absorption in the lamb. And then quality, as I mentioned, you know, we're aiming for 30 grams per liter of antibodies, and that's what this refractometer measures. So this, you know, the numbers that you read off it, if you get it somewhere around 20, that is good quality colostrum. So the main problems we run into with neonates are hypothermia or starvation, navel or joint infection, and scours. The hypothermia or starvation is probably by far the number one of the problems, but certainly the navel ill comes in when joint infection comes in when there's bacteria coming in through the navel most of the time, sometimes through the mouth, and get into the bloodstream and then get, you know, deposited somewhere near the joints and set up an infection there. And then scours can be, you know, caused by different things in lambs, coccidiosis or you know, whatever. I have a slide later, I think, about that. So let's go to hypothermia. So hypothermia or starvation is by far the number one killer of neonatal lambs. And in order to figure out, you know, how to treat it, you need to know the age of the lamb and the temperature of the lamb. And the cutoff points are 6 hours and 37 degrees. And I'll explain why that is. So the lambs are born with brown fat that is really quite magical. It is a fat that sits around the kidneys, around the heart, and in the gut. And it is very rapidly metabolizable, which means that they can mobilize this fat, and it will supply them with energy to keep their temperature up and to keep going. This is sort of what fuels them until they get, you know, a good feed of colostrum and start to digest milk. By 6 hours, that brown fat is often used up, and so they have really no energy left. 37 degrees is the magical temperature for digestive function. Once the temperature falls below that, the lamb tries to keep the main organs functioning, and the gut is generally just cut off. Like, you know, let's not think about digestion at this point. Let's think of keeping the heart and the brain and the liver going. And so feeding a lamb that's below 37 degrees, basically you're going to have a clot of something sitting there, but it's not going to be actually digested and helpful. So basically, if you have a cold lamb that's, you know, slow and not doing well, but it's still around 37 degrees, you can stomach tube it and warm it up. Normal temperature of a lamb is probably somewhere around 39 degrees or so. So if you have a cold lamb that's under 6 hours old, sometimes they chill very fast depending on how they're born. You can assume that they still have some brown fat. You can just warm them up to at least 37 degrees and then feed them some milk. If they're over 6 hours old, you have to consider that they have no energy reserves left. And these guys will need some intraperitoneal glucose before you can warm them up. Because if you warm these lambs up that are, you know, sometimes they're like 34, 35 degrees, maybe colder. And as you warm them up, they start to, you know, shiver and their muscles use up their last glucose. And they literally go into hypoglycemic fits. They will start, as they warm up, they start to seizure and then they die once they reach a higher temperature. So giving them glucose literally just into the belly cavity will supply them with the glucose they need when they're warmed up so that they, you know, don't go hypoglycemic, and then you feed them when they're warm enough. intraperitoneal glucose, if you go to the next slide, I have, I think, a picture. Yeah, so basically you would use dextrose. We're using 50% dextrose in hot water. You just boil some water on the stove and you draw up a syringe with half dextrose and half hot water, and you poke it into the abdomen of the lamb. And that seems crazy, but it's not. So you see in the bottom picture there, you see the navel of that lamb, and the needle is pointing just a little bit towards the back and to the side of the navel. And you just pop that needle through the belly wall, and the glucose will be around the gut. You don't put it into the gut, you just put it into the cavity, just squirt it in. And basically, as the lamb then slowly warms up, it will use that glucose to get its blood sugar up. And then once it's warm, you can feed it. I'll give a little lamb, I'll give them somewhere around 30 cc's. So half of the dextrose and half hot water. And if you mix it that way, if you just draw up your dextrose and then draw up boiling water, it makes exactly body temperature. So it's perfect temperature. Everything's ready to go. Okay. I don't know how I am for time. I'm like completely lost without any feedback from anyone, and I don't have a clock. So, okay.
It's currently 10 to 8.
Okay, perfect.
There's a question
So-
here. If a lamb doesn't get colostrum, should they be vaccinated? How do we protect them?
Right. So they need colostrum. Basically, you treat them like they have no immune system. So you would have to, vaccination is not going to help, because that relies on, you know, if you vaccinate something that relies on a functioning immune system to mount a response, and it will take about 2 weeks. So that is not gonna help the lamb at this point. There's all kinds of recipes out there for homemade colostrum. They don't work because you don't make homemade antibodies, right? So the homemade colostrum is really just sort of milk with some extra energy, like people put egg yolk or whatever in it. Basically, what you need to do is either get colostrum from another sheep, or get colostrum from, cow colostrum or powdered colostrum. Now, if the lamb is older than a day and it hasn't got any colostrum, I mean, you just have to really keep a close eye, because, I mean, you're not dying because you have no immune system. You're dying because you're really susceptible to any infection that comes along, right? So the question is, can you keep this animal well fed and sort of protected from infection? And you might have to use antibiotics to, I think antibiotics will be probably the main thing to prevent, big infections happening. I mean, it's not to say that they can't live. It's just that it's they're so much more susceptible, right?
Thank you. That's all for now.
Okay, so if there's losses, it's always good to investigate. Some death losses are normal. I mean, there is that old saying, if you have livestock, you have dead stock, and it's completely true. There's always that one sheep that will, kind of die because that's what they do. But good records help you know if there's a problem, right? So you want to know, when am I losing lambs, and what are your possibilities of why you do that? So are they lost before lambing? Are they abortions? Are they stillborn? Do I lose more when, between 0 and 5 days? Do I lose my lambs in the pre-weaning period or in the post-weaning period? Knowing where your majority of your losses happen helps you hone in on that category to figure out what's going on and how can you prevent it, right? Next. Okay, so the things that happen, different age groups have different problems, right? So obviously abortions happen usually in the last trimester. So you get often a mixture of abortions, which is like just something that's definitely not fully cooked coming out, and you know, there might be abnormalities or, you know, infection or something going on. Often abortions come as a mixture of stillborn, weak-born, and aborted fetuses. A small percentage of abortions are normal, maybe up to 2% can be normal. However, when your first sheep aborts, you don't know whether this is the first of many or whether this is just, you know, damn, lambing has started and here's an abortion, right? So if you have the fetus and the placenta, it's a good idea to just sort of wrap it up in double plastic and stick it in the freezer. Because if nothing happens, you kind of dig them into the manure pile or wherever you dispose of these later. But if there's more coming, then you have, you know, something that we can send off to figure out what's going on, because you need the fetus and the placenta to get any kind of results if you send it in to investigate. A lot of times the bacterium or the virus that causes this is sitting in the placenta and not in the fetus. So just sending the lamb is often not helpful. We need both the fetus and some of the plasmatomes, like the buttons of the placenta. Stillborn lambs can be, because they died in the uterus, so they can be part of an abortion scenario. They can be dead because it's birth trauma, that they were stuck too long, or that they came backwards and they were stuck halfway out, or that they were really weak and by the time we find them, they're dead and they don't look like they've done anything. And you don't really know whether they were born dead or they died right shortly after being born. Then we have neonatal lamb losses. They usually in the first week, a large proportion of those will be either because they are hypothermia or starvation. And or I haven't really talked about that before, but we call it hypothermia or starvation because it's usually a vicious cycle, right? It's like they get a little bit cold, they start to shiver, that uses up their energy, they get dopey, and they want to eat even less. And so that, like, those two are really hard to know which is the chicken and which is the egg. Like, you know, they you know, the less energy the lamb has, the colder it gets, you know, the more dopey it gets. So that's why we lump this as a syndrome together. Another one is an E. coli infection that leads to things like watery mouth. Basically, it's when they take in the right strain of E. coli right at birth, and it invades their gut and causes sort of like, they tend to slobber and might have a bit of diarrhea, and they die usually right quick if you're not on top of it. And then sometimes we lose some of them that were really weak at birth, and we pedal them along for a while. And sometimes I wonder whether you'd be better off to not do that, but we always do, because you know from the start, you start helping this lamb along, and you invest a whole bunch of energy into it, and then they die when they're like 4 days old or something, and you go, oh, I should have just not bothered with it. But it's hard to make that decision. And then in the pre-weaning period, so once they survive the first week and before they're weaned, the main things we're seeing are naval infection, joint dull, coccidiosis, which is like a parasite that causes diarrhea, and pneumonia, depending on the circumstances. And then in post-weaning, it's basically, it's a wide field. We see pneumonia, we see enterotoxemia, coccidiosis, listeriosis. At this point, they can pick up anything that a big sheep can pick up. But at the same time, too, in that period, they have a bit, they have their own immune system, and they're a little bit more hardy. So there's something to treat. Versus the little guys can be sometimes hard to do. Okay, any questions?
Okay, Chris, I had a question that came in earlier. Let me just find my chat box again because I lost it when I was doing the other stuff. Should you separate the ram during lambing season? Asks Andy.
If he doesn't cause any trouble, I don't see why you have to. I mean, I usually keep the rams out of there. I put the ram in only during breeding season, and otherwise they hang out in their ram group. If you only have one ram, and he's not causing trouble, then I don't see that it's a big deal. I mean, it's sort of, yeah. I like to separate them out just because I want to know that my sheep are bred between here and here. And then I know they're going to lamb between here and here. But
okay.
Yeah, I don't know. It's a personal choice.
Okay. Going back to the question about how you would treat a newborn that's badly aspirated.
What did he aspirate?
Karina doesn't tell me here, and I don't think she has a mic, so. Okay,
so usually aspiration pneumonia happens when they inhale something that they shouldn't. So sometimes when they're born backwards, we worry that they swallow or inhale fluid. It's actually not as common as you would think. They sometimes have a bit of a cough, but I think it's more in their throat. Like a real aspiration pneumonia is when you, for example, milk is a bad thing to get into your lungs because it sets up a bad reaction, right? The body rushes in and tries to mop up this foreign body in the lung, and a lot of inflammation happens. And yeah, usually those you will have to go and treat with anti-inflammatories, definitely, and with probably with antibiotics. The ones, if it's just after birth where they're hacking a bit, I find that usually fixes itself. But yeah, milk can be absolutely deadly.
Okay.
So tubing a lamp and filling it so that it's overfills, that can be a problem. That it if it's not just going into the stomach but into the larynx and then into the lungs, then yeah, that can set up that problems.
Marika asks if we will be able to give copies of the slides to everyone. Would that be okay, Chris?
Yeah, I guess that'll be fine.
Okay, we can turn them into a PDF, and that way they can't be modified or whatever. Someone asks, or
there's more stuff behind. So if you do that, there's more stuff behind.
We can make some modifications. Slide. We'll stop where you stopped. Yeah. Andy asks, is cocci checked for on regular fecals, and should you treat preventively at all?
Okay, so yes, a regular fecal will include we see any egg on there. So we see, parasite eggs, and we see coccidiosis. The problem with cocci is that yes, we see it on fecal, but we also need clinical signs because there's like a dozen or more different species of coccidiosis out there, and not all of them are pathogenic, meaning not all of them cause disease. So I want to see, usually with coccidiosis, what you see is that you get a lamb that starts looking sort of like a dog, like, dairy hair coat and pot belly and kind of moving slow and maybe some dark manure. oftentimes you will know that you have a problem at certain times in your lambing period. Some people have problems pre-weaning, some people have problems after weaning, some people have, like there's a certain period of time when you often see coccidiosis in your lambs. And so we can use bait cocks as a preventative. So if it's a drench that they get a couple of weeks before you normally see issues, and it works pretty well. Like at my place, we see problems when we wean the lambs early because we start milking. So we wean them at somewhere at 35 days or so, and they look fine. And then when they get weaned, they just sort of are looking terrible because you pick up cocci. And so we do them just before weaning, and that fixes the problem in most cases. If you only have the occasional one, you can certainly just treat them with some Amprol, and just treat the one lamb.
Okay, next question, maybe an odd question, but is there birth control for ewes, like an older one?
Keeping the ram away. So in general, if you get like the old arthritic ewe that you don't really want to breed again, that's sort of a pet, literally not having her run with the ram is probably the easiest, because we can, you could theoretically put a seeder into her, right, which is like a progesterone device, and that might, well, that would keep her out of heat, but you can only do that for so long, right? And at some point it will not work. So, and there's really nothing that we can give them to permanently keep them out of heat. I guess you could do a space surgery, but again, that's probably not a really feasible thing. So putting an apron on her, I don't know.
Okay, I'm sure that helps. Next question, would you recommend feeding colostrum to bottle lambs for 24 hours or longer?
If you have it, just feed it to them. It might not be absorbed through the gut anymore, but it still has a protective effect on the whole, like the inside of the gut. So it's good for digestion and all that. It's I find it's giving them, if not colostrum, at least sheep milk rather than powder for the first 2 days seems to be helpful. If you to wait 2 days before you switch them to milk replacer, because it's a lot easier digested and easier on their system and gets them a better start. So if you have it, yeah, absolutely feed them colostrum.
Great, lots of wonderful questions here. Next one, intraperitoneal injection in conjunction with warming box or wait?
I would give them the intraperitoneal injection and then stick them in your warming box. So I give it before I warm the sheep up, before I warm the lamb up.
Okay. A reason or just preference?
It's just that it takes a long time for a lamb to warm up. That's surprising. I mean, the ideal way to warm them up is probably to have the ideal way would be like to have like a slatted floor and you blow warm air from the bottom through, right? I use a banana carton with like a little electric blanket in it. So they sit on something warm and then I run a hairdryer on them. And it still takes a long time if they're really cold to warm up. And the glucose that sits in the cavity, it slowly gets absorbed through the gut, right? Instead of from the inside of the gut, it gets absorbed through the outside wall of the gut, but it still gets absorbed into the bloodstream. And as the lamb slowly warms up, it slowly absorbs the glucose, and it keeps the blood glucose up, right? And you need that for the brain. So as soon as they warm up, you want to have that energy available. So yeah, we bring them in the house, we give them the intraperitoneal glucose, we plunk them into the banana box.
Okay.
And then you have to wait. And then you occasionally take their temperature, and once they're over 37, you can then, I usually tube them with some colostrum or milk or whatever.
Ideally, how many years are ewes productive before they get old and may have problems lambing, aborting, etc.?
That depends. I mean, I have some that are, my oldest one is right now a W. She is J, so she's 11. But probably 7 or 8 for sure. They'll be good for that. Or they should be anyways.
Okay.
I mean, there's places where, you know, if you're looking in some out west large groups, what they do is they check the teeth, and everyone who has a full mouth, meaning they're 4 years or older, they cull them, because then they don't know how old they are and they don't want to run into problems. And they often have more teeth problems, because if you have poor grazing and they eat a lot of sand and stuff, you know, you can run into trouble. But I mean, we're pretty pampery to our sheep on average here, so I think they should probably last 7-8 years for sure.
Okay. What is a good size group to lamb out if you have more than 50 sheep? Should you separate bigger flocks?
Totally up to you. I mean, I've seen people lamb out 100 a day, so if you can handle it, handle it. If you have, it depends on, like, for example, if you want to run like a 3 times lambings in 2 years or something like that, you can try to separate them out into 2 groups. You know, so you lamb one in January, one in April, one in whatever. It's really your personal preference. We have like somewhere just under 100, and we usually lamb the main group in one bunch, and then we lamb the ewe lambs slightly later, so it's a bit warmer, and they're not as, you know, likely to run into hypothermia problems, because, you know, the ewe lambs might not be as attentive and stuff like that. So, you know, you can make, you know, whatever groups separated by a month to give you a bit of a breather, get the first group off to a good start. But really it's determined by, you know, how much room do you have? Like, does it drive you insane that you have to get up and check, or do you love that? Or, you know, hard to answer.
Okay. Are there often long-term effects to bottle lambs who have always been given powdered milk?
No, don't think so. Like, I think as long as they get colostrum and they're well fed, they grow up to be just fine. I don't usually see that they have more problems.
Okay. How can you induce lambing?
So sheep are actually very hard to abort, meaning that in a lot of cases, like in goats, for example, the pregnancy is depending on a CL on the ovary, which produces a hormone that maintains pregnancy. In the sheep, that is only true for the first months and a half or so, and after that, the placenta itself produces that hormone that maintains the pregnancy. And so we can give, you know, in goats, we can give lutalize, which gets rid of that structure on the ovary, and then, you know, the pregnancy ends. In sheep, we can give them lutalize and nothing happens. We can induce them if they're almost ready to lamb. So in probably the last 2 weeks of pregnancy, giving them steroids will basically mimic what happens in a normal lambing. In a normal situation, there's a steroid that's produced by the lamb that sets a cascade in motion to start the lambing process. And if we give them, so we would give them like 20 milligrams of dexamethasone And I usually give them some noodle ice too, just in case they have a CL on the ovary. And those two things together, if they're in the right window, they usually start lambing within 36 hours.
Okay. Next question is, I don't know if you'll have the answer. Any tricks on making a ewe count to 2?
Usually they should be fairly able to do that. It might just be that she does not like the one lamb. I don't know. I mean, if it is because sometimes it's, that they have a lamb and then they sit down and have the second one a little bit further away, and the first one gets up and wanders away, and then they just don't want it, or something like that. And it's in those cases, I sometimes use a foster gate. Basically, we have a head gate that the ewe gets like her head stuck in, so she can get up and down, but she can't run away. You put some food and water in front of her, and ideally the sides of that gate are closed so that she can't look behind her. And so you put that in the corner of a pen, and her head is stuck in it, and so she can eat and drink and get up and down, but she can't turn around. And you put the 2 lambs with her in that box, and then until they suck reliably, and then at some point everything smells the same, and a couple of days of that treatment, and then usually they keep the lambs, but depends. Either that or, cow prices are great.
Next question, on the eutoxemia slide, you mentioned skinny ewes are susceptible. What body condition score is skinny? What body condition score should they be at 5 to 6 weeks out in that lambing?
So ideally, I would like to see them at a 3.5 or so just before lambing, because they will all lose some weight after lambing. So 3 we always regard as like the ideal condition score, right? So 1 is completely emaciated, 2 is kind of, feeling every rib, but not completely emaciated. 3 is when they have good cover, and then 4 and 5, they get more and more fat. I mean, I have my one Texel sheep, and she's usually a 7 out of 5. And so that's ridiculous. But so a good 3.5 or up to 4 is great before lambing, which means they go in with some good condition on them, and then they lose about a condition score during early lactation often, or half of 1, depending on how well they eat. And so you try to keep them somewhere between 2.5 and 3.5 throughout the years is ideal. We used to say, like after weaning, you just kind of let them, basically they have time to regain condition. And so they would do like huge swings throughout the year, but it's actually, it's more economical, and it's better for the sheep to kind of stay in a good middle of the road condition throughout the year.
Okay. How close before lambing can we still safely shear?
An hour. I mean, as long as your shearer isn't like super rough and they're super stressed, they're nice to shear when they're big and round, and it's generally not a problem. Like we shear in the spring, and we're often not quite done lambing, and it's always better to shear the ones that haven't lambed, because they're easier to shear, and they do well.
Okay. You recommended
sorry. I say that 1 hour only half jokingly, because like it has happened that we sheared them and then put them right into the pen.
Okay. You recommended Clostridial vaccine 4 to 6 weeks before lambing. Can you still vaccinate them 2 to 3 weeks before lambing? Would this be less effective, or could it even be harmful to the ewe and the lamb, or the lamb?
Okay, it's not going to be harmful, and it's still okay. And 4 to 6 weeks is ideal. 2 to 3 weeks is good.
Okay. What is the best way to foster a lamb to a different mom?
So there's 3 methods, I think. Is like the one is what I described with the head gate. There's something that's called wet grafting, and then there's something where people skin a dead lamb and try to tie the hide onto the lamb to be fostered, which I find unpleasant at best. And I don't think that it's, some people seem to have good luck with it. I just not a personal favorite of mine. The very best way that I have found is that if you have a ewe that lambed and you suspect her to have a single, that you kind of catch her, tie her to a post or something, and you have her one lamb behind her, and then you grab whoever you want to foster, and you tie the legs together so they don't get up. So they're also like it's very unusual for a lamb to stand up and run away. So you want the lamb to be kind of lying down like the other one. And then you stick your arm back in, and you make, inside the sheep, you make a fist, and you kind of spread your hand out a bit, and you make her give birth to your hand. So spread it out a bit so that she, feels uncomfortable and pushes, and you sort of slowly, so she thinks she's having a second lamb, basically. And then you get a whole bunch of goop and glop out of the, fluids, and put it onto that second lamb. And then I just, if you have the legs tied together so it stays down, and then you put the other lamb on top of it so they're all one pile, and then you say, here, look, you have 2. And then usually they take 2.
Cool.
So that often works. That works the very best, I find. Sometimes you have sheep, they love lambs, and they just give them whatever, and they can be good, or they can be a real pain in the ass because they take anything that comes and make a mess of things. But yeah, so that's what I would call wet grafting, and that seems to be working the best. But you can try to basically they sell like musk and all kinds of different obnoxious smelling substances that you put on the ewe's nose and on the lambs, and then you put her into one of those foster gates and leave her there for a couple of days. And by that time, the problem is, the longer she has lambed and knows that she only has one, then that's hard to make her believe that all of a sudden she has 2.
Okay, great. Andy comments that he'd like to see the picture of the head gate that you use if possible. Do you have a picture of it?
Don't know. It's basically it's a frame that is like a 4-foot gate, sort of like a square. It has 2 uprights that and then there's plywood on both sides. So and the uprights are so that the head of the ewe can go through. And then there's a stick anchor to the bottom that flips up and down. So basically, she sticks her head through, you flip it up so that the area is just holding her neck. And then there's a bolt that goes through the top so that stick stays in position. I don't know, I'm not describing that super well, but it's like a regular head gate that you would find in a stanchion or something, right? Except that it's made from a frame of wood, where the bottom is like a bolt where there's that stick can pivot, right? And then basically the other sides are solid, so that the lambs don't crawl into the front, and she can't really look and see the lambs too good.
Okay, wonderful. Last question, and I know we've held you for a long time here, Chris, and I appreciate everyone's patience. Andy says, if we need the vet, is it better to call you out or bring the sheep or lamb to the clinic?
Doesn't matter. I have people that come in with their lambs, which is fine, or their sheep, and we go out. It's, if you have an easy method to transport it to the clinic, you save yourself the call fee. But if you have no way of, easily loading the sheep and getting it there. I mean, sometimes it's a question of, if it's a prolapse uterus that's hanging to the ground and is likely to get damaged in the transportation process, it's probably better to have us come out. If it's like something where you go, this is like, something that I need you to just look at, then yeah, you can bring them to the clinic.
Okay, wonderful. Chris, as always, you have shared a pile of information in a short period of time. You're always wonderful, and we thank you so much. It's kind of hard to give you a round of clapping ovation, but you can see everybody doing it, hopefully, and know that we all appreciate your time tonight and all the great information. Thank you, everyone, for agreeing to sit with us and to be on a little longer than we had anticipated, but so much great information to share. As Chris said, it's a really broad topic, so she did an amazing job to share what she did in such a short period of time. I thank you all for joining us. Please fill out the evaluation so we know what to cover next year. Enjoy the rest of your evening. Typically, I would say safe travels home, but you're already there, so it shouldn't be a problem. Anyways, hopefully we'll see you at other courses.
Already in pajama pants.
Take care, everyone.
Have a good night.
Bye-bye.
Bye.
That was great, Chris. Thank you.
Yeah, no worries. That was okay. I can let you know. Yeah, you can see anything that was after that thank you slide. There was a second topic, and so you can just delete those out.
Yeah, and we'll just turn it into a PDF or something so that they can't modify it or whatever. We'll get Nicole on that tomorrow morning or whenever I see her. Cool. Well, thank you very much. Take care.
Okay, take care.
Bye.
Okay.